Hey you guys, I know I mentioned before that I'm no longer doing treatments for melanoma, and I'm going to tell you guys why. I actually just got back from the VA hospital. I had to go do a MRI today for a little mass that they found in my brain last year. Luckily it was benign. Of course I was thinking the worst, thinking that my melanoma spread to my brain, but it didn't. But they are still monitoring it for growth. So, to recap, I was diagnosed with melanoma, stage 3B, in 2014. At the time, the first line of defense, medicine-wise, after surgery, radiation, was a drug called interferon, and the first month is basically an IV, the preloading month. They call it the preloading phase. An IV Monday, Tuesday, Wednesday, Thursday, and Friday for a month, 4 weeks in a row. So 20 IV doses, and then Monday, Wednesday, and Friday for 11 more months where I would inject my stomach. And the total for all that, if you add it up, is 152 doses. And it looks like 12 months on paper, but it took me like a year and a half to finish it, just because my white blood cells would get low, and then I'd need to inject myself with Neupogen, wait till my white blood cells came back up. It took a while. But then within maybe 4 or 5 months of me finishing that brings me to like 2016, the beginning of 2016. I think I had a PET scan in December probably, or maybe early January. Then I found out that it had spread to my lung. They did a wedge resection, removed part of my right lung, and started me on an immunotherapy treatment, which is kind of like steroids for your immune system, right? So the VA that I go to, they don't have a melanoma specialist. So I stayed on it for a year. A year ended up being 2 years, 3 years. I ended up staying on it from the beginning of 2016 all the way. My last dose was November of 2023. What had happened was a couple months earlier, I went outside, and I have 2 dogs. I have 2 border collies, and they like to chase my lure up and down my seawall. That's kind of how I get them exercise, and I tire them out, right? I'll cast my rod and reel it in, and my dogs chase my lure. So I went out one morning and I casted my fishing rod. Well, I had a lightning bolt go from my shoulder to the tip of my middle finger. I'd never felt it before, and I actually threw my fishing rod. When that happened, I threw it into the water accidentally. So I got my rod out of the water, and I didn't feel anything again. I felt okay, but then I noticed if I moved my arms really fast, I would get, on either arm, I would get a lightning bolt from my shoulder to the tip of my middle finger. And then maybe within like 20 minutes, I felt my butt was really hot. I felt like somebody was burning my butt. And I went in, I told my wife, I said, hey, something's wrong. I said, we need to go to the emergency room. So I went to this VA down in Cape Coral, which is about 40 minutes south of where I live. We drove down there. I went in there, and they didn't want to help me because of my cancer history. They said they didn't feel comfortable. I don't know if there was not a doctor there that day. It was just kind of an ambulatory care clinic. So they wanted me to go up to St. Petersburg, which is like an hour and 40 minutes north of me. So then I had to add in that extra 40 minutes. So it took me a couple hours. So we went up there, and as we were driving, I could feel the pain like just going down from my butt to my hamstrings, my calves. And by the time I got there to St. Pete, I couldn't even walk. I felt like I had no legs. I couldn't feel them. I had no control over them. I had to take a little wheelchair. When I went in there, they started my IV, they did blood work, scans. Well, the ER doc came out. He had looked at my history of all my chemotherapy and immunotherapy. And he was like, I'm surprised you can still walk. He said, us doctors, he said, I don't know if he was talking about ER docs or what, but he said they have like a collective term or phrase. He said they call these cancer treatments the what the fuck now medicines. He said because they're really good at keeping cancer at bay. He said, but they'll fuck up everything else in your body. That's exactly what he said to me, pretty much word for word. He was shocked. So they gave me a medicine that day through my IV Neurontin is the brand name, or gabapentin, for like seizures and nerve pain. And within an hour, I'd say 45 minutes to an hour, I had no pain. I felt great. So they gave me a prescription for this gabapentin, and I stayed on it for a while, and it helped, but it gave me really bad, like, suicidal thoughts. I couldn't stay on it. Like, I mean, I've been to Afghanistan. When I came back from Afghanistan, I went to Germany for 6 months. Within like 3 months of coming back, 3 or 4 months, I came back from Afghanistan. I deployed again to Germany, but I worked at this contingency aeromedical staging facility where we would intercept planes full of troops from Iraq or Afghanistan. And a lot of them were, you know, I saw triple amputees, burn victims. It was bad. And this medicine started giving me like flashbacks of that, and I had really bad suicidal thoughts. Every night I would have these thoughts. So I told my neurologist, I said, hey, I don't think I can stay on this medicine. It's really messing with my mind. So she put me on something else called Lyrica, pregabalin, and I've been on that since, and it has helped. So that was the reason why I stopped those treatments. But before my very last dose, my VA oncologist sent me to Moffitt Cancer Center up in Tampa to speak to a melanoma specialist. And she told me, her name was Dr. Eroglu, E-R-O-G-L-U, Eroglu is how you pronounce her name. She told me that I never should have been on that immunotherapy for more than 12 months. She said there's no indication to stay on it for more than 12 months. And I was on it for almost a full solid, like 8 years, 7.5, a little over 7.5 years I was on it. So it really messed my body up. It did my neck's all messed up. And if I don't take this nerve medication for the nerve pain, I'll definitely notice it. Things will start feeling like they're burning. Even if I lay in bed and I put my feet down, if my heels touch the bed, a soft bed, it starts to burn. It feels like someone's burning my feet. So it was really a big deal. And then, what was I gonna say? Yeah, I just had a PET scan last Monday, a little over a week ago. And then I had my TCON, my telephone consultation with my oncologist last Friday, and he said that I do have some swollen lymph nodes in my supraclavicular region, which I guess is the right side up here, somewhere at the base of my neck or base of my head or somewhere up here. There's some swollen lymph nodes. So he said I could go in for a biopsy, or I could wait to see if they get any bigger with my next PET scan. But he said they're so small right now that he thinks that they might not even be able to biopsy it. So I said I'll wait till my next PET scan, which for the last several years I've been doing PET scans every 6 months, but we're gonna do it this time 4 months out just to see if any melanoma has come back. He said it could also be leukemia, because I do have leukemia now. I'll make another video about that. So that's what's going on. That's why I'm not on any melanoma treatments at the time, and hopefully these lymph nodes are not melanoma, because I don't know what else is left. I know I can't go back on immunotherapy because of the nerve damage, so I really don't know what would be left for me, but I guess they'll have a plan, you know? So that's my story. That's why I'm not doing any melanoma treatments at the moment. Keep fighting. Cancer kills, so fight back.